On day one, I signed an executive order to stop all government censorship. No longer will our government label the speech of our own citizens as misinformation or disinformation, which are the favorite words of censors and those who wish to stop the free exchange of ideas and, frankly, progress.
We are the richest country in the history of the world, and yet we rank far below every other major country in terms of our life expectancy. That's outrageous. To me, equally outrageous is if you're working class in this country, you're going to live 6 or 7 years shorter lives than if you are rich.
The reason for that isn't necessarily due to wealth disparity. Yes, it's the lower classes that greatly influence supply and demand. So the more fast food they consume, the higher the prices, or the less food they'll get for their money when trying to keep prices down. But this is a lifestyle that they choose to live. Healthy food takes time and effort to prepare. Health is not just economical, it's also cultural.
We have a healthcare system that's broken. It's not working. You've been working on it your entire career. As Americans get less and less healthier, as premiums rose.
Bobby, I believe the healthcare system is broken.
He has asked me to fix it.
It's very important to take note that Bernie confirms and acknowledges that the healthcare system is broken. This is extremely relevant throughout the discussion. Even more important is the fact that Bernie, supposedly, has been working to fix this his entire political career.
In America today, 68,000 people die every year because they can't get to a doctor. They can't afford to get to a doctor. You pointed out yesterday the outrageous cost of healthcare in America.
If healthcare is broken,
our healthcare system is broken.
Then it wouldn't matter if a person can get to the doctor or not. Death is a natural consequence of an imperfect system. Nevertheless, people take advantage of the law which states that hospitals cannot deny care for those who walk into the ER. So, people die regardless of receiving healthcare. So in some ways, they can afford it. Then we have fat activists calling doctors fat-phobic for even suggesting a healthier lifestyle.
You know what? Our political system is broken and corrupt.
The problem of corruption is not just in the federal agencies, it's in Congress too. Almost all the members of this panel are accepting, including yourself, are accepting millions of dollars from the pharmaceutical industry. And protecting their interests.
Oh, I thought that would come. No. I ran for president like you. I got millions and millions of contributions. They did not come from the executives, not one nickel of PAC money from the pharmaceutical industry. They came from workers.
In 2020, you were the single largest
because I had
receiver of pharmaceutical money
from workers all over this country. Workers,
you were the single,
not a nickel from corporate
Bernie,
PACs.
you were the single largest acceptor of pharmaceutical dollars.
No, from workers in the industry.
1.5 million.
Yeah, out of 200 million. All right, but
still, you were the highest beneficiary. So, whatever you were pushing for at the time were in their favor.
You have not answered, last question. You have not answered my question.
Mr. Chairman, we're 3 minutes.
How do
we make America healthy if you don't guarantee health care?
Chairman, we're literally 3 minutes over here now.
Well,
how long does it keep going? At some time, you're just battering the witness, Bernie.
Not battering the witnesses.
Yes, you are. And you're getting upset at him. You're going at him just like anybody else would.
We'll come to order. Was the COVID vaccine, successful in saving millions of lives?
I don't know. We don't have a good surveillance system, unfortunately.
We don't know?
I don't think anybody can say that. If you show me science that says that.
You know, Bob, you say if I show you, you're applying for the job. I mean, clearly, you should know this. And that is, the scientific community has established that COVID vaccines save millions of lives, and you're casting doubt.
You know what also casts doubt? Asserting that we have a broken healthcare system. This very same healthcare system is the one coming out with these studies. Bernie pushing to put our faith in a broken healthcare system is just crazy.
There have been, as I understand it, dozens of studies done all over the world that make it very clear that vaccines do not cause autism. Now, you just said, if I heard correctly, well, if the evidence is there. The evidence is there. That's it. Vaccines do not cause autism. Do you agree with that?
As I said, I'm not going to go into HHS with any preordained.
I asked you a simple question, Bobby. The studies all over the world say it does not. What do you think?
Senator, if you show me those studies, I will absolutely, as I promised to Chairman Cassidy, I will apologize.
That is a very troubling response because the studies are there. Your job was to have looked at those studies as an applicant for this job. All right.
It is technically true that vaccines do not cause autism. By definition, cofactors cannot be labeled as a cause. But Bernie finds it troubling to hear that RFK Jr. would apologize to the American people if he is ever caught saying something not factually true. Here's the irony and possibly hypocrisy of Bernie. Even if RFK did the research and then came back with valid reasons against these studies, Bernie would still attack him, claiming that his own opinion is greater than that of RFK. Rand Paul affirms this hypocrisy.
But on the COVID vaccine and on the COVID illness, there was a 1,000-fold or more difference between the elderly and children. If you don't acknowledge that, you're committing malpractice. You're showing your ignorance. If you say a 6-month-old must be mandated to get it, the science is not there. So all this blather about the science says this and the science says that, no, it doesn't. The science actually shows that no healthy child in America died from COVID. Look it up. No healthy child died from COVID. And so the thing is that it's 1,000-fold greater. So if you ask me my advice as a physician, if you were 65 or older or overweight and some other conditions, I would have said, hell yes, I'd take the COVID vaccine. The risks of the disease were real and much greater than the vaccine. But if you ask me, should my healthy 6-month-old get it? See, these are the nuances you're unwilling to talk about because there's such a belief in submission. Submit to the government. Do what you're told. There is no discussion. There ought to be a debate. You're not going to let him have the debate because you're just going to criticize and say, it is this, and admit to it, or we're not going to appoint you. But it's more complicated than that. And this is why people distrust government, because you're unwilling to have these conversations. And go home, ask your Democrat young mothers, your Republican young mothers, if they're vaccinating their kid for hepatitis B, and they're like, well, do I have to do it on day one? It's this precious little baby. Is there science to say you shouldn't do it? Probably not, but it's my kid. You know, it's like, there isn't clear-cut science saying not to. But on autism, there's no good science of anything to show what causes autism. We don't know. It's a profound disease. I know many moms here and dads who have kids with autism. I know them personally. I've met their kids. But the thing is they saw their kids developing completely normal, maybe speaking 100 words go to no words at about 15 months of age. Now, there isn't proof. There isn't proof that the vaccines cause it. That's true. There isn't proof that it causes it. But we don't know what causes it yet, so shouldn't we be at least open-minded? We take 72 vaccines. Could it be? I don't know. But we shouldn't just close the door and say we're no longer, because we believe so much in submission, we're not going to have an open mind to study these things. And so it's sort of this crazy notion. Schizophrenia, I would put in the same notion. You have a kid who's completely normal to 18 or 19, and their brain goes haywire. How does that happen? It's the most bizarre disease. Shouldn't we be open? Could it be our food? It might be vaccines, it might be our food, but autism's more common. I don't know about the schizophrenia statistics, but autism is more common. Shouldn't we want to be open-minded? Instead, we're so closed-minded and we're so consensus-driven that the science says this. Well, science doesn't say anything. Science is a dispute, and 10 years from now, we could all be wrong. We were told in the beginning, 20 years ago, they did this enormous study, and they said, everybody over 50 should take an aspirin. I thought, well, that's a pretty good idea. It makes sense. But you know what? 20 years later, they measured it. And they found if you had no heart disease and you were taking aspirin, your chance of dying from a brain bleed or from a stomach bleed were greater than the risk of heart disease. If you have heart disease, they still say take an aspirin. If you don't, they've changed their mind 20 years later. But would you have all said I was crazy and I should no longer be in public discourse if I had said 20 years ago, I don't feel like taking an aspirin. I ride my bike all the time. I'm afraid I might hit my head. But that's what a country's about. It's what dissent is about. So just ask you to look at the larger picture and give the guy a break who says, I just want to follow the science where it leads without presupposition. I think really what we have up here is presupposition. You've already concluded. It's absolute that autism isn't caused by it. We don't know what causes autism, so we should be more humble in what we say. Sorry I didn't get to a question.
How do you make America healthy again if 1 out of 4 people in this country cannot afford the price of prescription drugs, which is far higher in America than any other country on earth.
Again, it doesn't matter if everyone can afford healthcare if the entire system is broken. An affordable, broken system is still broken. But it's almost like he's equating healthcare with prescription drugs. Neither of them, however, can change lifestyle, nor do they improve the quality of food, nor do they fix the economy. In fact, most drugs are designed under the assumption that people will not change their lifestyles. And that's because most people are unwilling to change. Welcome to Western culture.
We are the only major country on earth not to guarantee paid family and medical leave. Mr. Kennedy, there are women today who are having babies, then they got to go back to work in a week or two because they have no guaranteed paid family and medical leave. How do you have a healthy country when women are forced to go back to work, when women and men get fired because they stay home taking care of their sick kids? That's not making America healthy again.
This is a self-refuting argument. If you make America healthy again, you wouldn't need paid medical leave, which itself reveals that this isn't even relevant to the discussion. In fact, a healthy woman can definitely go back to work within a week or two after having given birth. It just so happens that most people today are unhealthy.
And I would go a little bit beyond the jurisdiction of Health and Human Services, but I think it's important. If you are working 50 or 60 hours a week, making 13, 14 bucks an hour, which is what millions of Americans are, can you be healthy? Will you join those of us who think that in the United States, wealthiest country on earth, people work 40 hours a week, they should not live in poverty, we've got to raise the minimum wage to a living wage?
Kennedy is like, this is a speech, not a conversation. I've touched on some of the problems that minimum wage causes for the economy in another video. Raising minimum wage would reduce overall health, but this ignores lifestyle. You don't need a high-paying job to have a healthy lifestyle.
We have not answered the question why in the richest country in the history of the world, our life expectancy is lower than it is in countries far poorer than we are.
Take note on why he said that. He's trying to push for universal health care.
If we want to make America healthy, will you assure the American people that you will fight to do what every other major country on earth does, guarantee health care to every single American?
Somehow he is convinced that affordable healthcare necessarily improves health, though he contradicts himself several times. Even if you fix the system, it doesn't fix demand for unhealthy lifestyles.
And one of the points I think that Mr. Kennedy made, which is right, healthcare is not just medical care. It's a lot more. Talk about the food industry. We have held a hearing, Senator Cassidy and I held a hearing a couple of months ago, where we made the point that the food industry is, in fact, poisoning our kids with addictive food that is leading to obesity, diabetes, heart conditions, etc. And I hope that our Congress and the White House will have the courage to take on a very powerful food industry and demand that the products that they sell our kids are in fact healthy and non-addictive. In many ways, what the food industry is doing today is what the tobacco industry did 50 or 60 years ago.
You know, we always love to blame other people for our own failings. You can eat junk food and still be healthy. The issue is eating nothing but junk food. Junk food has very little nutrition. If you were to compensate the lack of nutrition with leafy green vegetables with each meal, you would counter a lot of the problems of junk food. That is, so long as you get rid of sugar-rich beverages and snacks. But I'm not so sure you can compare nicotine with sugar.
And we talk about making America healthy today. Again, it's not just doctor care, medical care. We have millions of people working for starvation wages. You cannot be healthy if you're working 50 or 60 hours a week and you can't afford the rent that your landlord is charging you. Stress kills. Stress makes us sick.
That level of stress, however, can be easily managed by eating one bowl of leafy green vegetables every other day, which is fairly affordable even on low income. I've touched on some of the problems that minimum wage causes for the economy and healthcare in another video. I highly recommend that you watch it to its end.